Hydroxychloroquine and chloroquine are oral prescription drugs that have been used for treatment of malaria and certain inflammatory conditions. Chloroquine has been used for malaria treatment and chemoprophylaxis, and hydroxychloroquine is used for treatment of rheumatoid arthritis, systemic lupus erythematosus, and porphyria cutanea. In this video, we will talk about use, side effects, dosing, and various studies on these medications in COVID-19 or SARS-CoV-2. Do watch this video till the end. Welcome to Intellect Medicos, where learning is made easy by Dr. Shruti and Dr. Chirag Madan. I am working as an IC consultant at Apollo Hospital, New Delhi. You can leave your queries or questions in the comment section below. Now let's start. In some studies, it has been found that both the drugs have in vitro activity against SARS-CoV-2 and other coronaviruses. And in some other studies, it has been seen that hydroxychloroquine has relatively higher potency against SARS-CoV-2. Data to support the use of hydroxychloroquine and chloroquine for COVID-19 are limited and inconclusive. Still, a tweet by US President Trump on 21st March 2020 claiming that a combination of hydroxychloroquine and azithromycin has a real chance to be one of the biggest game changers in the history of medicine accelerated a worldwide run on the drug, with pharmacies reporting shortages within 24 hours. Now let's first discuss how chloroquine or hydroxychloroquine acts or its mechanism of action. This is a host cell having lysosome inside cytoplasm and ACE2 receptors on its outer surface, which helps in attachment of the virus. COVID-19 virus has spike proteins on its outer surface for the attachment to host cell. Chloroquine and hydroxychloroquine interferes with the glycosylation of ACE2 receptors and blocks the virus fusion with the host cell. Therefore, the binding of the virus to the receptors on the cell is impeded and infection is consequently prevented. Once hydroxychloroquine and chloroquine enter a cell, they are both concentrated in the organelle with low pH, such as endosomes and lysosomes. These drugs increase the pH of lysosomes, creating problem in cleavage of the surface spike proteins. Without the cleavage function, replication of and infection by coronavirus are blocked. Hydroxychloroquine and chloroquine are considered to be immunomodulators rather than immunosuppressants, preventing T cell activation. I'll not go into further details about microbiology or virology. If interested, I'll share the link in the description to learn more about immunomodulation. Now coming on to the side effects of hydroxychloroquine. Common side effects include headache, dizziness, gastrointestinal upset, and rash. Retinopathy is a serious side effect of hydroxychloroquine, and regular ophthalmic monitoring is recommended for patients on long-term therapy. Hydroxychloroquine or chloroquine can cause ventricular arrhythmias, QT prolongation, and other cardiac toxicity, which may pose particular risk to critically ill patients. In this ECG, you can see QT interval, which is prolonged in this particular example. Ideally, you should check for corrected QT interval, which is called as QTC. A small study in France enrolling 26 treated patients and 16 non-randomized controls showed that a hydroxychloroquine alone or in combination with azithromycin shortened the time to resolution of viral shedding of coronavirus 19 or COVID-19. Based on this study, clinicians in many countries have begun using these medications in clinical practice, and multiple randomized trials are being initiated. However, chloroquine, hydroxychloroquine, and azithromycin, they all prolong QT interval, raising concerns about the risk of arrhythmic death or from concurrent use of these medications. American College of Cardiology has given risk scores for the drug-associated QTc prolongation. These risk factors are age more than equal to 68 years, female sex, use of loop diuretic, serum potassium less than equal to 3.5 milliequivalents per liter, admission QTc more than 450 milliseconds, acute MI more than equal to 2 QTc prolonging drugs, sepsis, heart failure, or 1 QTc prolonging drug. The maximum risk score is 21. If the score is less than equal to 6 points, that indicates low risk. 7 to 10 points, moderate risk, and more than equal to 11 points, that is high risk. Potential absolute or relative contraindication for hydroxychloroquine azithromycin combination used in clinical research include: first, known congenital long QT syndrome; second, baseline QTc more than equal to 480 milliseconds; third, risk score more than equal to 11. In some experimental trials, it has been shown that increased intracellular zinc concentration are known to efficiently impair replication of coronavirus by inhibiting RNA-dependent RNA polymerase. So some physicians are using a combination of HCQ, that is hydroxychloroquine, azithromycin, and zinc, although this is not proven yet. Dosing recommended by some studies are as follows. Treatment: HCQ, that is hydroxychloroquine, 400 mg twice a day on day 1 and then 400 mg once a day for 5 days. Azithromycin, 500 mg once a day for 5 days. Whereas for the prophylaxis, hydroxychloroquine is to be taken as 400 mg twice a day on day 1 and then once a week for 7 weeks. Recently, randomized study from China in patients with mild to moderate COVID-19 found no difference in recovery rates. These drugs should be used only for, first of all, treatment of COVID-19 positive patients; second, as a prophylaxis for asymptomatic healthcare workers involved in care of suspected or confirmed cases of COVID-19, and also for asymptomatic household contacts of laboratory confirmed cases. Physicians should educate themselves about the strength of available data regarding hydroxychloroquine and chloroquine in treating COVID-19. They should avoid misuse of hydroxychloroquine and chloroquine for prophylaxis of COVID-19 because there are absolutely no data to support this. Recently, there have been reports of use of ivermectin, an anti-parasitic agent, in the treatment of COVID-19. It's not proven yet. I'll come up with new video if any update in the treatment or management comes. Till then, take very good care of yourself and your loved ones. Take appropriate precautions like good hand washing. Refrain yourself from going to the marketplaces or crowded places. Thank you guys for watching this video. Stay healthy and safe.